Katie Anderson. I'm an audiologist here at the Golden VA Outpatient Clinic, and I lead the virtual progressive tinnitus management workshop here at the VA. Today, I'm going to be recording the first of 4 classes. This is the audiology session, week number 1. So let me just go ahead and share my slides here. Okay, so again, this is the first of 2 audiology sessions that will be recorded. The intent is for those that may miss a class to use this as a makeup session. So just a little bit of overview about the workshop. This is the week 1 class, so this is sort of like the intro or overview of tinnitus. Week number 2 is cognitive behavioral therapy, also CBT, pleasant activities and relaxation exercises like deep breathing and imagery. And that class will be led by one of my psychology colleagues. Week number 3, which I also plan to record, will be focused on the tinnitus technology. So I will be covering the tinnitus apps and various sound machines that are available to you through the VA. And then we'll be doing a little bit of review about what we cover today. And then week 4 is thought errors. So reframing the way you think about the tinnitus. Again, this workshop is called Progressive Tinnitus Management. It was developed at the NCRAR, which stands for the National Center for Rehabilitative Auditory Research. They are located at the Portland, Oregon VA Medical Center. So because this is a recorded version, I'm going to skip our introductions. Normally we do introductions in the live class. All right, so what is tinnitus? Tinnitus is the perception of sound when there is no external sound source present. Tinnitus is considered to be a symptom and not a disease. Tinnitus can be perceived in one or both ears or in your head. And tinnitus is often reported as a high-pitched ring, a hissing, a buzzing, a roaring, a humming, or a whooshing. So tinnitus can have a lot of variations between people. 2 different people may have very different reports of, what their tinnitus sounds like. And that's something that I like about it. It's very unique, and the way that we treat it is not always the same for each person. So tinnitus can be classified as either subjective or objective. Subjective tinnitus is the perception of sound without the presence of an acoustic stimulus. So that means that you are the only person that can hear your tinnitus. I am not able to hear your tinnitus. It's all based on what you tell us. So there's not actually a test that we do in the clinic to measure tinnitus. It's all subjective. That's why we send out the tinnitus handicap inventory and tinnitus functional index surveys prior to class. Those surveys are very important and help us get a baseline of how severe your tinnitus is. So if you didn't already, please take the time to complete the survey and send it back to us, so that we do have an idea of how severe it is for you. So again, subjective tinnitus means that you are the only person that can hear it. Objective tinnitus would be extremely rare. In all of my years as an audiologist, I have never encountered objective tinnitus. This would be very rare, but this would mean that it could be heard by other people. And this would usually be due to an inner ear bone condition, blood vessel problem, or muscle contraction. So how do we define tinnitus? Usually the folks that end up in the PTM workshop have constant tinnitus, so it's there all the time. Sometimes you may have intermittent tinnitus, so that means that it lasts more than or equal to 5 minutes, and it occurs more than or equal to weekly. Occasional tinnitus would last more than or equal to 5 minutes, but it occurs less than weekly, so not every week. And then temporary tinnitus would be associated with a specific event. If you were to go to a loud concert and your ears were ringing after the concert, then you would have what we call temporary tinnitus. And spontaneous would just be transient ear noise. That's a normal phenomenon. So there are certain triggers, things that can make your tinnitus worse at times. I would say the two biggest triggers are lack of sleep. So if you're just feeling really fatigued or you just didn't get adequate sleep the night before, that can certainly cause your tinnitus to flare up. Also stress. So um, if you're under a lot of stress with COVID, that was a very stressful time for a lot of folks and definitely had an impact on their tinnitus. Other things would include anxiety, PTSD, depression, diet. So if you're drinking a lot of caffeine or high sodium, high salt intake, um, also things like nicotine, alcohol, and even noise. So if you're around, loud noise, or you did go to a loud sporting event or concert, those things can trigger tinnitus as well. So tinnitus is extremely common. It affects nearly 50 million Americans. Roughly 10 to 12 million of those folks have tinnitus chronically and seek medical attention. For many people with tinnitus, their quality of life can improve with treatment. And tinnitus is commonly accompanied by some degree of hearing loss. So, one study found that 62% of those with hearing loss reported tinnitus. This was the National Health and Nutrition Examination Survey. 6 to 8% reported persistent tinnitus despite having normal hearing. So it is possible to have persistent tinnitus even if you do have normal hearing. Usually, prior to enrolling in this workshop, we would like for you to have a recent hearing test. So that means um, normally within the past year, you should have had a hearing test. And when we test your hearing in the clinic, um, we test 250 to 8,000 hertz. But it is possible, maybe you have normal hearing in those frequencies, but you have hearing loss in the frequencies beyond 8,000 hertz. So it is possible that you have some cochlear damage in the ultra high frequencies, and that may be contributing to the tinnitus. There are certain industries that would have an increased risk of tinnitus, including manufacturing, motor vehicle, musicians, all loud, and a lot of noise exposure. Certainly, if you're watching this recording, I'm sure you've had a lot of noise exposure during your military service as well. And often tinnitus patients have what we call a decreased sound tolerance. So that means they may be more sensitive to loud sounds. They may become bothered by loud sounds quicker than somebody that doesn't have tinnitus or hearing loss. So that is commonly reported. So this is just kind of a diagram that's breaking down the different categories of tinnitus. So of those folks that have tinnitus, which is 10 to 15% of all adults, approximately 80% of those people have what we call non-bothersome tinnitus. So I would be in that category myself. I have some intermittent tinnitus, but at this point, it's not bothersome. It's not affecting my quality of life. And then approximately 20% of people have mild, moderate, or severe tinnitus. So you can see the pyramid there, and then at the very top, you'll see debilitating tinnitus. So this is affecting their daily activities, and they just really need further help at that point. And here you'll see a diagram of the veterans that are service connected for tinnitus. So last data that I had was from 2019, and at that point, 2.1 million veterans were service connected for tinnitus. So you're definitely not alone in this. You can see each couple of years. It's the numbers have just continued to rise. It is the number one service-connected disability here in the VA, so extremely common for veterans. So what causes tinnitus? Well, there are certain theories. The causes of tinnitus can originate from different sources. Um, Probably the biggest one that I mentioned earlier is loud noise exposure. And I do like to start with a handout. So, in the packet of supplies that you would have received from me in the mail, there is a handout in there. Uh, it's titled Most Commonly Prescribed Drugs with Tinnitus as a Potential Side Effect. So, you should have received a handout like this in the mail, and it's just something to keep for your reference. So, if you are on any of these medications, they do have tinnitus as a known side effect, and this would just be a conversation that you would want to have with your primary care provider. We don't want you to stop taking anything without having that conversation, but it's just something that you could bring up. Maybe you could try a lower dose or ask if there's an alternative medicine that might work for you. So it's just something to be aware of. Other causes can include wax in your ears, stress, ototoxicity. So if you were undergoing chemotherapy or radiation, if you had a head or neck trauma like a whiplash, acoustic neuroma, which is a tumor, jaw misalignment, so TMJ, Meniere's disease, or even hypo or hyperthyroidism. So you should have received from me in the mail a workbook, and in the workbook, there is an ear diagram, which is on page 67. And I kind of like to just talk about how we hear sound and then how that relates to tinnitus. So if you want to, you can go ahead and turn to page 67. And there you will see a diagram of the ear. The ear is divided into three sections. So we have the outer ear, the middle ear, and the inner ear. So the outer ear is what picks up the sound waves, which then vibrates the eardrum, and that sends vibrations through to the three smallest bones in your body, the malleus, incus, and stapes, and that sets the fluid in motion inside the cochlea. So the cochlea is your organ of hearing. It's the snail-shaped organ there, and the sound waves are converted into electrical impulses, which are sent via the auditory nerve up to the brain. So that's how we hear sound. Happens super quick. And inside the cochlea, so the organ of hearing, that's where the hair cells are. So you have approximately 16,000 hair cells inside your cochlea, and they're tuned to different frequencies. So low frequencies up to high frequencies. And so when we have loud noise exposure, that causes damage to the hair cells in your inner ear. And the regions of damaged hair cells are involved in the making of tinnitus. So damage to the cochlea decreases the auditory nerve activity, which increases the spontaneous firing rate of neurons in the central nervous system. The neural synchrony model states that increased neural synchrony in the area of hearing loss may contribute to tinnitus. So essentially, the nerve cells are becoming hyperactive and occur at the same time, and they simulate a tone that the brain hears as tinnitus. So tinnitus is a reaction in the brain to damage in the ear and the auditory system. Some people have compared this to the phantom limb theory. So if you were to lose a limb in your body, you may still have sensations as if it's still there. Sort of the same with tinnitus. So you've got damage to these hair cells in your inner ear, and your brain is interpreting sound even when there's no sound present. So unfortunately, there is no cure at this point in time to eliminate tinnitus, nothing FDA proven. The goal of this workshop is for us to help you learn how to manage your reactions to the tinnitus. So you can't change the sound of the tinnitus, but you can change how you react to it. We don't want you to spend money on any sort of products you see offering to cure tinnitus. You know, veterans have told me a lot of different things they've tried over the years, tinnitus 911 pills, various commercials on TV or other products that they've purchased. And I wouldn't recommend any of those without talking to us first. Most things that you could go and pay for, you can get here through the VA. So definitely give us a call if you do have a question about something that you see related to tinnitus. So this slide is from the IDA Institute. It's the tinnitus forecast. And it's just showing how over time your tinnitus will still be there, but your distress is going down. So you're paying less and less attention to it, and hopefully learning how to manage it better than you have been. And so the goal of this workshop is habituation. So habituation is a form of learning in which an organism decreases or ceases to respond to a stimulus after repeated presentations. So we can change the way you perceive your tinnitus, influence how you feel about it, and change the way you react to it. And we do this using sound therapy, so we can retrain the brain to focus on other more important or more relevant sounds. And your tinnitus does not prove to be a threat or a danger anymore. So if you've heard of the fight or flight response, when you have tinnitus, your body is perceiving the tinnitus as a threat or a danger. And so we're trying to kind of get a better sense of control over the tinnitus so that that doesn't happen anymore. So this next slide is just showing how stress, anxiety, and tinnitus are all connected. When you have tinnitus, that can create a negative emotional response, which can lead to an increase in stress, which can cause your tinnitus to increase as well. So we're trying to get one of these under control, which will have a positive impact on the others. All right, so again, the goals of this workshop are to reduce your emotional reactions to the tinnitus, help reduce your stress. We will focus on relaxation exercises, pleasant activities, and cognitive behavioral therapy in the psychology portion of this workshop. Eventually get you to a point so that little, if any, attention is given to the tinnitus, or you are learning how to habituate or get better at ignoring it over time. And hopefully the tinnitus does not affect your daily life activities in a major way, and further help is not needed or wanted. So these goals can be reached even if the sound of your tinnitus does not change. I'm going to skip this slide since we don't have a live group today. Um, so the goal of week 1 is to develop an action plan for using sound to manage your tinnitus. We call this a sound plan. So you should have again received a workbook from me in the mail. And in the back of the workbook, I believe it's right after page 106, you will see the sound plan worksheet. It looks like this here. So if you can, I'd like you to turn to a blank worksheet. There's actually a couple of them in your workbook, but just turn to one of them and hopefully you have a pen handy as well. So number 1 on the sound plan worksheet, it says write down one bothersome tinnitus situation. So that's where we start. And oops, in your workbook as well, if you turn to page 29, you'll see the tinnitus problem checklist. So the tinnitus problem checklist, it's got 1, 2, and 3 on here, and it's asking you to identify when is your tinnitus the most bothersome. So falling asleep at night, staying asleep at night, waking in the morning, reading, working at the computer, relaxing, napping, planning activities, driving, or other. So I'd like for you to identify at least one problematic tinnitus situation and then jot that down next to number 1 on the sound plan. So you can complete the tinnitus problem checklist. Again, that's on page 29 in your workbook. And then, so go ahead and jot down at least one problematic tinnitus situation on your sound plan worksheet under number 1. So here we have an example. He wrote down falling asleep at night, which is one that I hear probably most commonly, falling asleep, staying asleep. So now we're going to talk about how we classify sound. So we do that in 3 different ways: soothing sound, background sound, and interesting sound. So the first being a soothing sound. So this is a sound that makes you feel better as soon as you hear it, and it's giving you a sense of relief from tension and stress caused by your tinnitus. You can use a soothing sound anytime that your tinnitus is bothering you. So that's one thing about tinnitus, is that we recommend not doing anything in quiet. This first class is really trying to hopefully help you identify different sounds that you can incorporate so that you're minimizing your quiet environments more than you have been. So here are a few different examples of soothing sounds. We've got ocean waves, music, campfire, waterfall, thunderstorm, nature. I am going to try to play a soothing sound for you on my tablet here, just so that you can hear one example. There is an app that I like a lot. It's called Relaxiness. So just the word relax and then INESS, all one word, Relaxiness. And this app is great because it has all different variations of water sounds. And I do hear for a lot of folks that they prefer water sounds. So there's like rain, thunderstorm. I'm just going to pull up the app and try to play one. Okay, so that app was called Relaxiness. And for those that like the water sounds, that would be a free app that you could try. So hopefully, in looking at this little chart at the bottom here, you can identify, did you feel no relief, slight relief, mild relief, moderate relief, nearly complete relief, or complete relief? So the sound you just heard may be more soothing to some people and less soothing to others. Your job is to find sounds that are soothing for you. So that's, one thing that I like about tinnitus. It is a lot of trial and error, and it's really different in management for each person. So, we all have different sounds that we would prefer to listen to, but this might take some time and patience to really identify the sounds that are the most soothing and helpful for you. So sound preference, I guess, like I just mentioned here, has great variance. What is soothing and therapeutic to one individual might be considered annoying or distracting to another person. Dr. Henry did a study here, and he found that air and water sounds used in sound therapy caused the least amount of annoyance to the subjects. So these sounds were preferred over other options. So the second type of sound is a background sound. And this is a sound that is neutral, so it's not soothing, it's not interesting, not annoying, it's just there. And it's reducing the contrast to make it easier to ignore your tinnitus. You can use this anytime your tinnitus is bothering you. So here you'll see, if you're sitting in a dark room, all of your attention naturally goes to this candle. It's the only thing that you see. So there's a sharp contrast between the bright candle and the dark room. The candle is naturally attracting all of your attention. But when you turn the lights on, the candle is just as bright as before. But it's not the first thing that you would notice. So there's other things to look at here. The contrast between the candle and the room has been reduced. Um, so that's what we're trying to do with tinnitus by incorporating sound. You know, when you're sitting in a very quiet room, when you're trying to sleep at night in quiet, it's naturally attracting all of your attention, the tinnitus, because there's no other sounds to listen to. By incorporating more sounds into your environment in your day, um, you're giving your brain other sounds to focus on and other sounds to listen to so that you do get better at ignoring the tinnitus. So same candle, different backgrounds, the same idea works for tinnitus. Here I have a few more examples of background sounds. So we've got music, radio static. A fan is a great one. I know quite a few people use a fan to sleep. White noise, guitar noise, traffic noise, wind noise, air conditioner. If you have pets or kids at home, they would also make a lot of background noise. So the tinnitus is less likely to get your attention when you're adding in a background sound. You may not notice the background sound helping you right away, but that doesn't mean that it's not helping you. So I would continue to use it even if you're not noticing improvement right away. Using background sound over the next few weeks and months can help you get to a point where you do get better at ignoring the tinnitus. But we don't want you to use any sounds that are irritating or annoying to you. So here are a few more examples of background sounds. We have a humidifier, a CPAP, air conditioner or furnace, dog or cat, pets or kids if you have them, a tabletop fountain, and a fan. So those are just a few ideas. I'm going to try to play another sound on my tablet here. So this is actually just a fan, but this app is called Starkey Relax. And so if you want to download it, it's one of the hearing aid companies. Again, it's called Starkey Relax. And I'm going to play a fan sound. Okay, so that was one example of a background sound that you could try. YouTube is another great source for getting some of these different sounds. So I did attach a YouTube link of a background sound here if you want to try that one. And so the last type of sound is what we call interesting sound. So an interesting sound is a sound that is keeping your attention. It involves active listening. It's shifting your attention away from the tinnitus when you do not need to concentrate on something else. Some people may be able to use interesting sound before bed. Other people may not want to. If it's too much stimulation or it kind of gets your mind going, then you may want to focus on using soothing or background sounds before bed. So here's just a few more examples of interesting sound. We've got talk radio, a TV program that you like. A lot of people like podcasts, so podcasts are great for interesting sounds. Audiobooks. So if you have the Audible app, um, so those are just a few examples for you. Okay. So you can try out, a passage that may be interesting to you. I would just recommend trying a podcast or an audiobook or maybe talk radio and see if you can find something that you enjoy listening to. Your job is to find sounds that are interesting to you. And remember that it will take some time and patience to find the sounds that are the most interesting and helpful for you. We don't want you to use any sounds that are irritating or annoying to you to manage your reactions to the tinnitus. So like I mentioned earlier, interesting sound can be a powerful way to get your mind off the tinnitus. This helps some people relax enough to get to sleep. It may not be helpful for others. So that's something that you may need to experiment with. But try to be open to using sound in different ways than you have done previously. So we have now covered soothing, background, and interesting sounds. And you'll see on your sound plan worksheet here, each type. What I'd like for you to do is to write down one example of each type. So I want you to identify at least one soothing sound, one background sound, and one interesting sound that you'll try over the next few weeks. And then you'll also write down the device that you will use to get that sound into your ears. So just take a minute and write down an example for each type. And here you'll see a completed example sound plan worksheet. So this is for Bob. He is going to try a background sound being a fan, and he's going to use a box fan. He is going to try an interesting sound, TV program, talk radio, books on tape, and then he'll use his TV in the bedroom, radio, and CD player by the bed. And then, so this is really a way for you to track over the next few weeks if these sounds are helpful for you, not at all the way up to extremely. So I'd like to get your feedback if you can use this tracking worksheet and just sort of helps you identify what's working and what's not. So you can use sounds in your environment, you can use music or speech. So there's a lot of different sound combinations here. And these are just some more ideas for sound. We have sounds of nature like water sounds, beach sounds, forest, animals, wind, storms. We also have man-made sounds like masking noise. So for those folks that wear hearing aids, um, all of the hearing aid companies that we work with now have masking capabilities. So you could have them programmed to have either some ocean waves or some white noise um, in your hearing aids if that's something that you would like to do. You can also use a fan, so sounds that are man-made, so air conditioner, furnace, humidifier, traffic, radio static, etc. And then music. So we all have our own preferred styles of music. There's so many styles of music. Any music that's neutral or pleasant can be used to manage your tinnitus as long as it is not too loud. So as you fill out the sound plan, I'd like for you to develop a plan that is easy to do and practical for you. And for now, you are going to use sounds and devices that you already have. And then as you keep track of what's working and what's not, we'll learn what helps the most and hopefully get some ideas about how to improve your plan over time. So you have completed your first sound plan. Um, we do offer another virtual workshop here at the VA, and I just like to mention this workshop because sometimes we have folks end up in the progressive tinnitus management group and they realize that they have more of a hearing problem. And so I just like to mention this. We do have another virtual class. It's called Here's to You. It's an oral rehab virtual group offered on 4 consecutive Thursdays from 1:30 to 3. This is taught by my colleague, Dr. Barsuk. So if you are finding how does your hearing loss affect you and your significant other? Do you hear people but still find it difficult to understand them? Do you want to have a better understanding of your audiogram and what sounds you are missing? How can you troubleshoot the environment? How can you communicate better with friends and family? So if any of that sounds interesting to you, you can actually call the audiology department at the number listed there and request to enroll in the oral rehab group. So in the second recorded session that I will be doing, that's when we cover the different tinnitus sound machines, as well as the tinnitus apps. So I will be getting more into that material in the next session. All right. So um, this workshop again is called Progressive Tinnitus Management. We're really trying to combine all approaches into one. So we're offering different forms of tinnitus masking. You may have heard of tinnitus retraining therapy, which is um, sound therapy and also counseling, which that's why psychology is involved in the workshop as well, to cover the psychology aspects. But really, we're trying to incorporate all approaches into one. So other things you can do to minimize your tinnitus problem, protect your ears. So anytime you are around excessive noise, you should be wearing hearing protection, either squishy plugs, custom hearing protection, or the ear muffs would all work. Try as much as you can to reduce your stress and to get adequate sleep and eat a healthy diet. Okay. So, and then one last thing, there is a lot of, a lot of information regarding tinnitus on the internet. Some of it may not be from a reliable source. So I just included a few links here at the end. The materials that I got for this workshop they came from the NCRAR, which again is the National Center for Rehabilitative Auditory Research. They're in Portland, Oregon. So you can check out their website there if you're interested. Um, and then the American Tinnitus Association is ata.org. So I would just make sure or encourage you to make sure whatever you're reading is coming from a reliable source because there is a lot of misinformation when it comes to tinnitus. Okay, so we have concluded our um, first session for the Progressive Tinnitus Management Workshop.